Alright, so I'm going to be doing my postpartum assessment on my mother here. Not my mother. That mother. Someone's mother. So I'm just going to get started with that. Alrighty, so I would want to make sure I have all my equipment that I need to take into the room. Which I would with my equipment. Get my gloves. Put those over here. Then I provide patient privacy and hand hygiene. Hi, my name is Scott. I'll be your student nurse today. Can you tell me your name, please? Okay, and your date of birth? Alrighty, any allergies you might have? Okay, that's good, no allergies? Okay, so today I'm just going to be doing a postpartum assessment. You just gave birth yesterday, correct? Congratulations, that's awesome. So I'm just going to be assessing some things, and just let me know if there's any pain or anything. Okay, sounds good. So, do you have any pain, just to start? A little bit? How would you rate your pain from a scale of 0 being no pain, to 10 being the worst pain you've ever had? About a 2.5? Okay, that's not too bad. Does that seem manageable for you? It is? Okay, that's good. Where's your pain? Okay, around your birth site, around the perineal area. Okay, so that'd be a normal finding for this mother. She just gave birth. Does the pain radiate anywhere, upwards or downwards, or at all? No, it's just pretty localized? Okay, good. Is it a sharp pain, a dull pain? How would you describe it? A little bit sharp? Okay. A little bit achy? Okay. Does it get worse or better when you do any certain activities? A little worse with moving around? Okay, but not too bad? Okay. And then does it affect daily activities or activities in your life? Not too much? Okay, that's a good finding. I'm happy to hear that. So, do you have any headache at all? No headache? That's good. Any blurred vision or vision problems, spots in your vision, anything like that? No? Okay. That's also a good finding. Those could be indicative of different problems, but preeclampsia is one we're looking out for. So anything that points to that would be good to know, but she doesn't have either of those, which is good. Okay, and then, so you told me your name. Can you tell me where you're at? And what year it is? Okay, so patient is alert and oriented ×3, indicating that she has full mental function, so that's good. So I'm just going to assess a couple other things here for her reflexes. Alright, one is a deep tendon reflex, so I do not have a reflex hammer with me, but I'm going to use this. So deep tendon reflex, I would test the patellar reflex, just hit right below the patella, and it should bounce up like that, but not too much, so I'll grade it as a 2+, which is good. A 3+ or 4+ would be hyperreflexia and could be indicative of a condition such as preeclampsia, which is also what we're looking out for, but that's another sign that she does not have that, which is good. Okay, and I'd also test for clonus. So just relax here, I'm going to roll the ankle, and then jerk it upwards. There was no beats of clonus, which is good, so I put 0 beats of clonus. Make sure that's documented. Okay, and then while I'm here, I'm going to assess for the Homan sign. And so that I'm just going to flex her foot, dorsiflex her foot, like that. Is there any pain there? No? Okay, good. There's no heat on the bottom side of the calf, which is good. So that tells me that there is just testing for deep vein thrombosis. So it doesn't look like she has that, which is good. I test that on both sides. Okay. So, and I'd also raise the bed up if I were in the hospital, but this is kind of a makeshift clinic here, so we're working on the floor. Alright, so I'm going to assess your heart rate, okay? So I would listen to her heart. And the heart rate is a regular rate, or it seems like, yeah, I listened to it for longer than that, but it appears regular, So I'm now going to listen for the sounds in the aortic, pulmonic, Urbis point, tricuspid, and mitral areas. So listen to the aortic, pulmonic, Urbis point, tricuspid, and mitral valve areas. And I did not hear any murmurs or any abnormal heart sounds. I heard clear S1 and S2. And I would listen to the heart rate for a minute. My watch. And once it was a minute, I would record that. I recorded it as 80 beats per minute, which is normal. So that would be a good and normal finding. And I would confirm other vital signs as well, such as blood pressure. I would use the cuff for that, or pulse oximetry. Pulse oximeter says 98%, which is good, and blood pressure is within normal limits as well. All right, I would then assess both lobes of the or both sides of the lungs in each lobe. So, go right. Okay. I did not hear any adventitious breath sounds. I heard no crackles, wheezes, or any kind of rubbing, which is good. Respiratory rate is normal, and I recorded the rate at about 18 per minute, which is within normal limits. I'm also going to check capillary refill, which should be under 3 seconds. Under 3 seconds. Under 3 seconds, good. And I do that on both sides. Good, and good. Okay. I don't know any swelling on the arms. Capillary refill on both sides was good. This is the IV. So the IV side, so I would check for any swelling, any redness, signs of IV slipping out of a vein and causing any kind of excess drainage under the skin, which I don't see. So the IV side looks good, no reactions there. I would take the radial pulse on both sides bilaterally. I would note that as a 2+, which is good. I'd take that for a minute and confirm. Pulse is at 80, both sides. I'd also take the pedal pulse laterally to the bone on the foot. I note that as about a 1+, which is normal for the feet. Both sides. I would check for edema at the ankles. There's about probably a 1+ edema at the ankles, which is also normal after pregnancy, as feet often swell. Okay, so no major problems cardiovascularly or systemically with the circulatory system that I've noted. Okay, now I'm going to assess bowel sounds. I'm just going to lift your shirt up here, okay. Let's start in the lower right quadrant, the upper right quadrant, and upper left, and lower left. All right, I heard bowel sounds present ×4, which is good. I'm just going to palpate a little bit. Just let me know if there's any pain. There shouldn't be any pain around the liver area. That could be another sign of preeclampsia. Is there any pain there? He says no, which is good. Bowel is majorly soft. I don't see any distension or hard masses, which is good. So that'd be good. So I'll come back to the GI later after when I assess bowel movements, but for now we're going to leave that. I'm going to assess the reproductive areas now. Starting with the breasts. I was asked, is it okay if you're exposed? I just need to assess your breasts real quick. So I'd look at them, make sure there's no redness majorly or any kind of signs of no infection or lack of skin integrity or disruption there. So they look good. Skin tone is even throughout. I'm going to palpate. They feel soft, some nodular areas, but that would be normal with milk ducts and things like that. There might be some tenderness, but there shouldn't be extreme amount of pain. Nipples are intact. They're not split at all. They don't show any signs of bleeding or redness, which is good, or dryness. She should have a proper fitting bra to support her with it, whether she's breastfeeding or not, and she is breastfeeding, and that has been going well. The baby is latching, so that is good. Okay, and now, we're going to assess the vaginal area. So, when was the last time you changed your pad? Okay, she changed her pad about 2 hours ago. She gave birth yesterday. So I'm just going to take that out. So I would put on my gloves here. I'm just going with this. And I would remove the pad. And I would state the amount and type of drainage that was on there. So it'd approximately be a small amount of lochia rubra, which is appropriate for the first few days after birth. So that would be appropriate. It'd be either lochia rubra, lochia serosa, or lochia alba. And so it is dark red. There are minimal clots, which is good, and there's no real foul odor to it, so that is good. So I would throw that away and give her a new pad. Then I would remove my gloves. Okay, that'd go in the trash. All right, I'm going to assess the uterus and fundus. So I just feel around for that. I would support the base and just feel for the top of the fundus. Okay, and it should be about the umbilical area, especially around the first 24 hours. It should be at about the umbilicus, and then it should go down about 1 centimeter every day after that. Okay, I feel the top of the fundus. It is right about umbilical line, which is good. It is fairly firm, which is good. If we're boggy at all, I want to massage that until it firmed up, but it is firm, so that is good. There wasn't very, very small amount of drainage was expelled upon pressing upon the uterus, but it appears that everything is good there. And I note the linea nigra, which is there, should subside in a few months, but that is a normal finding. All right. When is the last time you went to take a bowel movement or had a bowel movement? This morning. Okay, that's very good. Okay, so she had a bowel movement this morning, which is about 20 hours after she gave birth, which is good. It can be common for women to not have a bowel movement within the first day or so after giving birth, but she has, which is good. Any problems there? Any pain? Not too much? Okay, good. Okay, and she had bowel sounds present, so everything's working in there. All right, I'm just going to turn you over here, and I would just assess for hemorrhoids. Number 1, okay, I don't see any hemorrhoids, which is good. There might be a little bit, and that can be normal, just minor hemorrhoids, but there shouldn't be any major bleeding or redness, which I don't see. And back here I'm going to assess for edema, which there's no sacral edema, which is good. And then if there was an epidural injection, I would also assess that site as well, make sure there's no swelling around that or redness, make sure that's healing well, which it is. She did have an epidural. And then I would assess for episiotomies or lacerations that occurred during pregnancy. She did not have any episiotomies, but there was about a 1-degree tear, but there's not much redness, no ecchymosis, no drainage. The edges are very well approximated, and it looks like it's healing well. So no signs of infection there, so that is good. So we're going to turn back over. Have you been urinating? Okay, is there any problems with that? Any pain? Any burning? Okay, and what color has it been? It should be about a light bright yellow, clear, no cloudiness at all or anything like that, no real foul odor. And if there was a Foley catheter in, make sure that is anchored. Assess the drainage from that. But there's no catheter and she's been urinating fine, so that is a good sign. Alright, and I assessed the extremities and the IV site. Everything else. Urinary, integumentary, uterus. Oh, and if there was a incision for a C-section, I would assess the incision site, but she gave a vaginal birth, so there's no incision to assess. But she looks good. She's adapting to postpartum well. There's no signs of preeclampsia or postpartum hemorrhage or things like that. Her mental state is good, so she's doing very well, and we'll continue to monitor her. She's been requesting lots of bananas. But other than that, everything's normal. So, alright, I hope you have a great day. I will perform hand hygiene and head on out. Alright, so I'm going to do my newborn assessment now on the infant after the maternal assessment. So, first thing I want to do is, just enter a room like I normally would. So I'm going to enter the room, provide patient privacy, hand hygiene. I need to get permission from or just introduce myself first to the parents. Hi, my name is Scott. I'll be your student nurse today. And I can ID them if I need to. I'll do that with the infant since it's the infant's assessment. I need to get permission, so I'll be your student nurse. Is it okay if I just do some assessments on your child? Congratulations, by the way, that's awesome. I'll just be right here. I'll let you know what I'm doing. You can just stay right here. Okay, great. So the first thing that I want to do is just not to disturb the infant too much. I'm going to observe the sleep-wake cycle. So this would be either a deep sleep, which is their very deep sleep, it's kind of hard to wake them, a light sleep, which where they might come to by the sound of my voice, or just slight movements, drowsy, which they're visibly very tired, their eyes are kind of droopy, and other things indicating they're very tired. Quiet alert, which is what we want, which is where they wake up and they're alert, but they're not fussy, they're not crying, they're not agitated. Active alert is they're awake, but they might be moving around more frantically, or they might seem a little fussy. And then crying, which they're visibly agitated and crying. So ideally, they would be quiet alert. So I note that the baby is quiet alert. There is awoken to the sound of my voice and appears curious about my presence, but isn't agitated. I want to confirm vital signs from the monitor. Make sure pulse oximetry is good, blood pressure is good, pulse rate is within normal range as well. Right, and then I would just observe, do a head-to-toe assessment, so I'd start with the head. Baby probably wouldn't have this much hair, but you never know. But you would want to feel for the suture lines and just see how they're doing. They might either be split apart a little bit, well approximated, or overlapping, but I note that they're well approximated on all sides of the head. I note the anterior diamond-shaped fontanelle is present, and it is flat. It's not bulging. Bulging could be a sign of increased intracranial pressure, which could be a problem. And if it's sunken, that could be dehydration, but I note that it's flat, and then the triangle-shaped posterior fontanelle is also flat and not sunken or bulging either, so that is good. I don't know any redness. The skin looks intact, no rashes. I don't know any lesions, which is good. There's a slight kind of bulge to the back posterior corner. This is common, often called caput succedaneum. And this just happens from the pressure that is caused on the head from the birth. It's kind of a buildup of fluid or blood on the outside of the skull under the skin. So just monitor that. And then something we don't want is cephalohematoma on the head, and that's just a buildup of blood between the bone and the periosteum, and that just needs to be monitored. Make sure it doesn't get any bigger, any worse. But for now, that's okay. Then moving down, the eyes. Note that they're both symmetrical. I don't know any major redness around the eyes or discharge. Eyes are both blinking at the same time, and everything. The palpebral fissures are present. There is one thing you might want to notice is the subconjunctival hemorrhage, which can be noted as white spots on the sclera of the eyes, which there's a slight amount of that, but that's not an uncommon finding and just needs to be monitored again. Another thing is swelling under the eyelids or anything like that, which I don't note, but that is also can be a normal finding. Just again needs to be documented and followed up to make sure there's no further problems with that. The nose. The nose is midline, and I don't see any redness, lesions. I don't see any deviated septum, which is good. We'll just test the patency of each nose, so I'm going to block each nair and hold the mouth closed and make sure each side can be breathed out of by the infant, which is good, so I note that. The mouth is present, and infant seems to have full control of their movements. I'm gonna test their sucking reflex. So I'm gonna just stick a finger in their mouth with the pad facing upward, and the infant sucks on my finger, which is good. I'm gonna feel for the soft and hard palates, and everything feels fine there. The mucosa is pink and moist. There's no teeth present. I don't know any bleeding or redness there, which is good. I'm gonna test for, and I would have gloves on for that probably when I put my fingers in their mouth. So just imagine I had a glove on. Then I would test the rooting reflex. So I would just stroke from the corner of the mouth out, and they should turn their head, which he does. It's a boy, by the way. He turns the head the other way as well. So those are both good findings. All right, the rest of the body looks good. The neck looks fine. Yeah, so we'll go down. I'm gonna listen to the heart sounds using the APE2MAN acronym. So I should have a pediatric stethoscope. Listen to aortic, pulmonic, Erb's point, tricuspid, and mitral valves. I note that the rhythm is regular. I hear S1 and S2. I don't hear any murmurs, which is good. Everything seems normal. And then I'm going to auscultate for a full minute. Alright, it's been a minute, and I note that the heartbeat is 140 beats per minute, which is appropriate. It should be between 110 and 160, so that is a good normal finding. Okay, and then I'm going to just assess pulses as well. So I'm going to assess the brachial pulse bilaterally. Note that it is present, it's +2. This side as well. It's present on both sides. That's good. Listen to the lung fields. Notice that there's no adventitious lung sounds. Lung sounds are clear. There's no crackles or wheezes. I don't hear any grunting on the expirations, which is good. No signs of respiratory distress. That's another thing with the mouth. If there was any kind of oral cyanosis, that could be a dangerous sign of respiratory distress if there's blue coloring around the mouth. So if there was blue coloring around the mouth, I would stop the assessment immediately and check for the breathing, if there were signs of nasal flaring or substernal or intercostal retractions, and implement appropriate interventions to get the baby stabilized. But another thing could be is just bruising. So if there isn't signs of respiratory distress and oxygen levels are good, it's probably just bruising. So that's something I would also look out for around the mouth. But lung sounds are good. I would assess bowel sounds as well. So let's start in the lower right and go upper right, upper left, lower left. Okay, bowel sounds are present times 4, which is good. I'm confirmed with the mother. Has he passed the stool yet? Okay, he has. Very good. So he's 1 day old and he's passed his first meconium. So that tells me he has a patent anus, which is good. He's passed that, so that is a good and normal finding. Okay, moving down, we're going to just assess the legs. I'll make sure there are bilateral leg folds. Make sure that there's no hip dysplasia or anything like that. So just make sure the folds in the leg are in the same spot. No, nothing off there. So that is good. I see that the folds are in the same spot. With the feet, I want to check for the Babinski reflex. So I'm going to stroke up in a J pattern towards the toes. And the toes should flare out on the infant, the opposite of what should happen to an adult. And it's present on both feet. Toes both flared out. And another thing on the upper body I would do is check for clavicles, make sure they're intact, not broken or dislocated. So I would put 2 fingers over the clavicle, and then I would rotate the arm in a circle, both sides. And if the infant screamed, or if I felt any kind of crepitus or unsmooth movements or palpable misalignment, that could be a sign of fracture or dislocation. So, but there's none there. They're both intact. Infant is not crying, so that is good. So then I'm going to turn the infant on his front. And again, this is on a warmer. The infant needs to stay warm. This isn't exactly the most ideal shape, but assume this is flat. Make sure the infant's head is tilted sideways so they can breathe. And I'm going to check for spinal alignment. I note that it is vertically aligned in midline, which is good. I check his name is Joel. Look at that. Okay, so Joel has, check for dimples on the sacral area, and I note there's no spina bifida, which is good. And then I turn Joel back over and make sure I support the head through both of those movements. I note the spine was easily flexed. There wasn't any rigidity or lack of range of motion there, so that was good. I'm then going to assess the genitalia area. So Joel is a boy, so I'm going to check the scrotal area. And around the penis. Alright, so I'll pull. He wouldn't have jeans on, ideally, but let's say those are off. I palpate each scrotum lightly to make sure both testicles are descended and present. Check for rugae if he's full term. Make sure that's there. It's just kind of a wrinkly surface. Check the penile area for any kind of, if he's circumcised, just check the insertion site, or the circumcision site. Check for any kind of discharge or bleeding. There shouldn't be bleeding. So I don't know any bleeding or discharge, redness, swelling, bruising at all. So that is good. It's healing well. And then I also check the umbilicus. Make sure it's clamped well. I should still be able to see 2 arteries and a vein, but there shouldn't be any bleeding or drainage out of that, so just make sure it's clamped well, and there's no signs of infection, redness, bruising, drainage, all that. And then I can take my gloves off. Oh, then make sure the meatus of the penis is midline and intact as well. And then palpate the abdomen. Make sure it is soft, no distension, no hardness, no kind of abnormal looking features. It looks symmetrical. It looks round but not overly bulging. It's round and soft. I didn't know, again, any abnormal features. Overall, no swelling. So then, after my assessment, which is now concluded, I would make sure the infant is reclothed. If it needed a new diaper, I'd provide a new diaper and make sure the assessments, make sure that the infant is going to the bathroom regularly, via breastfeeding. If they're feeding, they should be having 6 to 8 whipped diapers a day and all that. And again, their vital signs are all good. Their blood pressure, pulse ox, and breath sounds and pulse are all within normal limits. And I would clothe them, make sure they're swaddled, new diaper, give them back to mom, or keep them in the warmer. But that will conclude my assessment. And I would provide hand hygiene, and hope you have a good day. Thank you, Joel. You've been great. All right. Just a couple other things I forgot to mention that I would do is I would check the ID band after the parent would identify them, but just to make sure, check the ID band, make sure that aligns, and scan it if appropriate. And then the moral reflex is one that is also important to do, which you can do by picking up the infant gently and then just kind of gently setting them down, dropping them like that. Their arms should reach out like this and then kind of curl back in, and kind of their hands make a C shape. And then as well, and then also assessing for their muscle tone. So they should be somewhat flexed, not all the way flexed in, but generally flexed. So I know that they have good flexion. They're not flaccid or floppy. They have good flexion of their arms and legs. So that is a good finding. Then I'd further test their grip reflexes. So their hand, if I place my finger in their hand, they should grip it like that. And then also under the toes, if I put my finger under their toes, they should also grip down like such. But those things are important to note, that their muscle tone and reflexes are working well, and that you have the right patient, which is another important thing.